Delta Dental is our current dental carrier. I think we've had them now for, this is our third.
2014
Yeah.
started.
And they came back with a renewal with a flat, no increase. And we would recommend that we keep Delta Dental for another year, or another 3-year contract.
They offered 3 years at the same rate of $3.05 per employee per month. It's been $3.05 since 2014.
Okay,
Sounds good.
all right. And that will be on the 30th as well. And then discussion regarding agreement with Union Bank to administer the county's HSA plan.
Now that's something that, of course, the one commissioner that really had a keen interest is not here today for that. But that's, if you still want to talk about it and vet the whole thing, Kathy can do that if you want to.
Yeah, we may have to brief him, but that's fine.
Do you want me to go ahead?
Uh-huh.
Okay. So, I was here back in July, I think, talking to the board about this issue. Currently, Union Bank hosts the county's health savings account plan, which is the high deductible plan that about 50 employees participate in. And they've been hosting that since its inception, which I think was around 2010. It used to be they did not charge monthly maintenance fees to the employee. That changed over the years to about $20 a year was the annual fee, and recently, back in July of this year, they upped it another $4 annually, so it's now $24 a year for the employee. And that prompted a discussion about, well, maybe we should look around and go to a different bank. I did provide some information last time, just preliminarily from other banks. Yes, there are other banks out there that would do this without the maintenance fee. There's a couple. However, there may be charges from Union Bank to move to that other bank, so it kind of ends up being a wash. There's a $20 fee to move. So the discussion was going towards, well, what if we were to stay with Union Bank for a couple more years because they're going to freeze their rates. They said we will not raise them again until 2019. And then prior to the end of that, perhaps go out for an RFP and do it in a more global way, because there's other things that banks offer the employees for as far as investing this money, and it gets a little bit more complicated than just the monthly maintenance fee. So I do have a contract that they sent over, and that would freeze this rate until the end of December of 2018. And I just wondered if you wanted me to go ahead and put it on the board's agenda.
Yeah, I did have a discussion with Commissioner Boyle about that sheet, and we went through it, and then if he hasn't, he may want to come in and talk to you a little bit
Sure.
more about
Yep.
it, but in the end, he was okay with just staying.
I thought so. I
And
just
then
wasn't-
moving what you just said
Okay.
in the future, so I think we're okay.
Okay. I just wanted to make
Yeah.
sure I kind of followed up on it. So.
Yeah.
Okay.
Yep.
Sounds
Yep.
good. Thank you.
We do have other business.
Other business?
So the issue regarding wellness incentive, and I'll have Kathy Adair explain how we used to do gift cards, and then they became taxable, and that was an issue. So there is an alternative that Kathy would like us to consider.
Basically, most employers that offer a wellness program, it's based on a premium incentive as opposed to just giving them cash or a gift card or whatever the case might be. Never became an issue given those gift cards until we came to the conclusion that it has to be taxed. And believe me, if my email box didn't get overloaded and my voicemail with very, very disgruntled employees, that they were going to be taxed. And we started taxing them on the one that they earned in 2015, and it was paid out in January of 2016. And I've tried to get participation up. We've had discussions at some of these HR committee meetings, and we propose to have a 2-tier program for 2016, meaning that if they earned their first 100 points to get their 2 required wellness items, we would award them the $100 gift card right away. And I will tell you, it did boost up the membership registration, and employees were really excited because I give those gift cards out on a once a month basis when I run the report. The second gift card, we even had 300 and some people have earned those already, and those were given out last month. We'll give the second round of second gift cards in December after the December 1st date. I will tell you, this is an overwhelming experience for our office, with just myself and one other individual trying to handle this and running these reports every month and getting out, 200 or 300 gift cards every month. It's quite overwhelming. Plus, you order the gift cards, you have to wait a month to get the gift cards. You got people calling wanting the gift cards, and then you got the other bunch complaining because they're getting taxed on the gift cards. What I would like to propose, and I've worked with Vivari over the last few years, to try to move to a premium incentive, whereas once they earn their points in one calendar year, then the first of the following year they will earn a premium reduction. And
In 2018.
in 2018. So generally in October, I have to work out whatever our program design is going to be for the wellness program for the next calendar year. I work with Vivari and say this is, what we're going to do. So around October, we need to decide what we're going to do for 2017. And quite frankly, I do not recommend doing the gift cards. Besides the fact that it's overwhelming, it's a lot of time that's taken up to distribute, to order, to do the whole 9 yards of that. Get the information down to payroll. Payroll has to, they're inundated with it as well, to put it on the payroll, to get the taxes taken out. A premium incentive would, I think, number one, incentivize employees to participate, because if they know they're going to get a discount on their premium each pay period, it's going to affect them. I think we'll get more participation, and that's really what we want them to do, is participate and do the wellness items. And we had Aon kind of run some numbers as to what kind of a discount that would be. If the employee would meet their requirements in 2017, in 2018 their premium would be reduced by $25 a pay period. $25 a month, which is $300 a year, which is really more than they're getting now with the gift card, because the gift card is $200. If they have a spouse that participates, that would be another $25 discount on that level. So potentially somebody that's covering a spouse and themselves, they could get a $50 discount per month on their premium. And a lot, not only do I think that would be a better way to go to increase our participation, secondly, it doesn't take lump sum monies out of our medical fund, because right now the gift cards that I've ordered 1,600 gift cards since the first of the year at $100 a piece, which is $160,000 that has come out already out of that medical fund. Whereas it's going to be $25 or $50 less going into that. Plus, this is a pre-tax, medical premiums are pre-taxed, so it's not really going to ultimately affect that employee. If you give them a $100 gift card, they get about $60 of that gift card. Whereas now you're going to give them $25 less they're paying on their premium. That $25 naturally is going to be on their gross income to be taxable, but at a whole lot less amount of money that would be, a little effect on them. Plus, I believe, like I said, most employers are doing this already. This is really
how successful wellness plans are.
Yeah.
So
Patrick?
So just really quickly, I believe that the unions will receive this favorably, although technically it is something that we have to vet with the unions. So I would ask that, in the interim between now and October, that Diana Marcos go to the unions and say, this is the plan, let us know if you have any questions or concerns. If not, we're going to move forward with it. So you would earn, during 17, you would do what you have to do to get the points, and then in 2018 is when you start getting the premium incentive.
Yes, and what I would request that you do that with them, and then make up an executive summary sheet that's very easy to understand. That this is what we have, this is where we're moving, this is the positive for it, and not only have Diane and Marcos use that when they talk to the unions, but send it out to the commissioners as well, so that we have it, because we may get calls too. But it's, again, if you have something, just a one pager, bullet, easy, pictures are nice.
Yep.
Clever.
For those of us
Dollars in
unhealthy
the wallet.
skeptics that don't come in for these things, because I don't want somebody to tell me to quit smoking cigars, do we really know that we're saving $600 on these couples that participate in the wellness program? Is it really worth $600 to the county to have them in it?
Well, I don't know that. I think we'll probably be able to start getting some statistics from Vivare now that we've been, let's see, 14, 15. This is our, we're really right. Last month were 2 full years.
Okay.
The problem happens to be you're basing it on a very small group of individuals right now that are participating. I think that getting premium incentive is going to get more people on board. Maybe not necessarily the first year, but once they realize I can save $25 a month or I can save $50 a month on my premiums, and I hear about premiums, even though our premiums are pretty low, I still hear about premiums with individuals. I think we're going to get more participation for people to do these activities, and we're not going to tell you that you can't smoke your cigars. Believe me,
I'm not going to give you the chance.
no, but
But we
we're
want
going to
you to
get
come in to do
you.
your screening.
You're going to get your screenings done,
It does
which
help.
is one of the
It does
what
help.
is the one main thing that we'd like to have our employees do is get their biometric screening. We're offering them at no cost to them. Now this year we're going to have them a second time in August and September. We're asking you to answer the member health assessment questions, and those are 2 requirements. We also would like and require for you to get your preventive care. Those the biometrics and your preventive care are going to be 2 things that are going to show if there's early stages of anything going on with the employee, which then we can assist them. Now we've offered the coaching, so we have coaching available to an individual. So if it is somebody that is smoking, that would like to quit smoking, they can tap into the coaching aspect with Vivare, and Vivare is going to help them. If it's somebody that is overweight and they want some nutritional help in coaching, they're able to get that as well. So we're not here to tell you to do or not to do, things that may be good or not good for you. We're just asking you to do these things because we think we can help. And I can just tell you from my experience since we've offered the biometrics, I've had a handful of individuals, not a large number, but a handful of them that have directly come to me and said, I am so glad this happened because they found this out about my husband, or I found out I had onset of early diabetes, or I have asthma and I didn't know what was wrong.
Okay.
So I think it's just another tool that we have that can get early onset of something that's happening, and I think that a premium incentive will pull these individuals in.
I think that the data is real clear that if you can get people to move on preventative care, that you're saving money and it's more effective than waiting after the fact and trying to deal with an event that occurs that you could have prevented.
Okay.
We already know that diabetes is an issue with our population. We know that heart disease is an issue with our population, along with a couple other things that we believe that, and I think statistics show if you get in on the early part of that, you maybe can help them turn, things around, get them to watch their diet better, get on a nutritional program, utilize the coaching, which we started offering the coaching in January of this year. So I just think it's the right thing to go. You give somebody a $100 Visa gift card, they forgot about the fact that they took their biometrics and their health and their members' health assessment. They're out there maybe at the fast food joint, you just that $100. Whereas if this is something that hits you every single month for a reduction in your premium, I think the thought process might be a little bit different. Plus, it's not extracting large dollars of money out of the medical fund to pay for the gift cards. It's taking a little bits not going into the medical fund. So I think it's the right move. especially since we've started to get the participation levels up this year.
Thank you.
And so you're the perfect test.
Troglodyte.
person. Yes. So we'll keep an eye on you.
Just keep raising my premiums, lowering everybody else's. Eventually it'll come around.
The other thing is it's all voluntary, so we're not requiring you to participate. If
We
you
are
don't,
him now.
well, okay.
One exception.
We're not requiring Patrick to participate.
So-
If he doesn't
so
want to
basically-
participate, that's fine. He just makes the choice that he doesn't want a reduced premium.
Well, you didn't hear. The county board made a policy
Okay.
that all departments under the direction of the county board, including the commissioners, have to do it,
And their spouses.
and their spouses.
Well, and I think that's a
I
great
guess we forgot to
policy.
send you that.
Must have been
So-
last week while I was gone, huh?
Just don't put that in writing.
So I guess just to conclude it and wrap it up, all we're just doing is getting the consensus of the committee that this is what we want to. Obviously, this is something the county board will need to formally approve, but we want to just. And when would we do that? When would we have the formal approval?
Well, I'd like to do it before the 1st of October because
Okay.
I
But we
have
wanna
to work
get
with
the
Vivari to make this up and plan, and then what we do from that point, once we get the contract with Vivari and say this is the program design that we're going to do for 17, earning the incentive for 18, then we would present that, I would imagine, for the county board to approve. We then put together a letter that goes directly to the employee's home address explaining what the new program for 17 is going to be.
So and we'll get the union's input before that.
Yeah, oh, yeah.
Good.
Yeah. And then when you come to the board, I think a good presentation, PowerPoint of where we're moving, so everybody understands where we're moving is going to be helpful. We'll just do it on a day Claire's not going to do it.
Appreciate it.
Yeah.
And Vivari, their contract with us expires the end of this year, but they have given us notice that they would extend it for 3 years at no additional cost, so the rates will be flat.
Nice.
So we'll have that kind of all part of this.
Yep.
Good.
Good. Great.
Jolene got that for you too.
Good.
Yes.
Ah.
Yes,
They
she
want
did.
they wanted an increase, but she doesn't let them.
Good job.
Well, and then they also wanted to eliminate their per employee fee for coaching, as opposed, I mean, if an employee reaches out and wants coaching, we pay $125 for that person for the whole year. What they wanted to move to was a per employee per month cost. And I struggle with that because we only have about 36 that have reached out so far for coaching. That when I ran the numbers, it was just far out there that it wasn't worth it. And so she fussed with them. We kind of said, well, doesn't look like we're going to work with you then on this because we'll have to eliminate coaching because I can't justify to a county board to spend this kind of money when we have just this small amount. Now, I think coaching will improve with the population increasing, but they've agreed to, for us, just do that one-time fee per individual for the year. So I think it's a good thing.
And I don't take the insurance, so I
Right.
don't get the wellness piece of it. So is there, do they do a good marketing, if you will, of what's there for the employees?
If we get the employee to go out to the Vivari portal, and they each have their own individual portal, they sign up with a username and a specific password for them. I think the portal's excellent. I mean, you could probably speak to it a little bit better, but there is so many different things on a monthly basis that an individual can do. I get employees coming up to me and go, am I the top of the points? Do I have the most points? Last year, we offered the top 5 people an additional gift card so
But
that
I
they
mean,
would
how
get.
do we get that out to the
population.
population so that they know? I mean, it's kind of like when we do the food drive thing. People will watch where everybody is when we put out every Friday, what department has so much. Although we have found that they're tricking where they're not reporting to the end. But, so that then incentivizes the other department, God, we gotta go out and get a case of corn. And then that ups their numbers. So this, if we would work with them to have some kind of system that puts out kind of these incentive things for employees to do that. Oh, yeah, I think I'll do that.
We have 5 big, large bulletin boards throughout the county, one down on the Harney level,
Yeah.
where all of our wellness stuff, all the
Yeah.
flyers. Anytime we have a program going on where we have employer challenges, I send out a
Massive
flyer,
email.
massive email to those departments, and I think for the most part, most of those departments are really good. If you ever notice when I send those out, because I conclude the commissioners, I send them to department heads, elected officials, and then department designees.
Right.
Because sometimes we don't always get the department heads or elected officials to get that communication out to the employees. So those department designees are usually pretty good. So we do a lot of that.
When you, if the board approves the premium incentive, we could create a marketing piece. Bavaria could help you create a marketing piece. And as much as I don't like it, the most effective place to put communication is a bathroom stall. Put it on the wall of the bathroom stall, because everybody goes into the bathroom, they use the bathroom, and you're a captive audience. You can only look ahead.
I know
So
the building commission.
They don't
will
allow
They wouldn't allow
They
that.
wouldn't
Okay.
allow that.
They're pretty particular
Are they?
on where
And
we
I
can
know
put stuff.
somebody. I was like, look at what a problem he is.
Go to-
2 things now.
Go to Boyle's, if you can
See-
get it for you.
Our other areas, like the health center and the health department, and, you know, those, they're very good about posting that just about everywhere that they can. In this particular building, I tried. I've even put it up, and they're just somebody calls immediately, and I have to take them down. Unless I can put it on the bulletin boards, which I can, and I have, and get that signed off, there's really no other place that we can do that,
Well,
I do
even
as
if
mu-
it was a challenge, like, again, some of the things we've done to challenge the departments to get, 100% of their employees and they get X or whatever. I don't know. We can talk about that later, but I just think that marketing it goes, all of the stuff that we're responsible for when it comes to public health, we talk about wellness. When it comes to employees, and that's what we're kind of preaching out to the public. Here we are at the county, and we should be,
the first ahead of it.
yes.
Well, we'll send out during open enrollment, right prior to open enrollment, like the end of October, I send out a letter to everybody's home address, no matter if you have the insurance or you don't have the insurance, to their home address, letting them know when open enrollment is. And that would be an excellent time to put something else in there with this new program and what the potential premium incentive savings could be for them. So.
Well, and it may be, again, we work with the unions because they're also very key in kind of gathering the employees, pushing the employees to do different or do the things you want them to do. So anyway, we can talk about that.
Great.
Okay.
Great.
I don't
So
think
everybody
there's-
okay with that one? Any other questions or comments? Any other business?
I don't think there was there?
Mhm.
Okay.
Okay, all right.
Thank you.
Then we
Good.
are adjourned.
Thank
What
you.
time is the other meeting at?
1:30.
Okay, thanks.
And back here again.
Back here.